A new dawn for hair loss. Enter low-dose oral minoxidil. Hair loss can be a distressing experience, impacting self-esteem and confidence. For years, people have sought effective solutions to combat this common concern. While topical minoxidil has been a mainstay treatment, a new contender has emerged: low-dose oral minoxidil. This innovative approach offers a promising alternative, potentially providing more significant and consistent results. Low-dose oral minoxidil has generated considerable buzz in the medical community, sparking hope for individuals struggling with hair loss. This essay delves into the science behind low-dose oral minoxidil, exploring its effectiveness, safety, and potential benefits. We'll examine the science, clinical evidence, and personal stories that highlight its potential as a game-changer in the field of hair restoration. Unlocking hair growth. The science behind minoxidil. Minoxidil, initially developed as a blood pressure medication, surprised researchers when it demonstrated a remarkable side effect: hair growth. This serendipitous discovery revolutionized hair loss treatment, leading to its widespread use. Minoxidil is a potassium channel opener, promoting hair growth by increasing blood flow to hair follicles. This enhanced blood flow delivers essential nutrients and oxygen to the follicles, stimulating hair growth and prolonging the hair growth cycle. While the exact mechanisms are not fully understood, minoxidil is believed to stimulate the production of vascular endothelial growth factor, a protein that promotes the formation of new blood vessels. This increased vascularization in the scalp contributes to the improved nourishment of hair follicles. Evidence speaks: low-dose oral minoxidil and hair regrowth. Numerous studies have investigated the effectiveness of low-dose oral minoxidil for hair loss. A growing body of evidence suggests that it can be a highly effective treatment option, often outperforming topical minoxidil in terms of hair regrowth. One study published in the Journal of the American Academy of Dermatology found that low-dose oral minoxidil led to significant hair regrowth in both men and women with androgenetic alopecia, the most common type of hair loss. Participants who received oral minoxidil experienced a greater increase in hair count and hair thickness compared to those who received a placebo. Another study published in the International Journal of Trichology reported similar findings, with low-dose oral minoxidil demonstrating superior efficacy to topical minoxidil in promoting hair growth and improving hair density. These studies highlight the potential of low-dose oral minoxidil as a safe and effective treatment option for individuals seeking to restore their hair. Safety first. Understanding potential side effects. While generally considered safe, low-dose oral minoxidil can cause side effects in some individuals. It's essential to be aware of these potential side effects and discuss them with your doctor before starting treatment. Common side effects are typically mild and may include headache, dizziness, and scalp itching. These side effects often subside on their own as the body adjusts to the medication. In rare cases, more serious side effects can occur, such as low blood pressure, rapid heartbeat, or fluid retention. It's crucial to seek immediate medical attention if you experience any severe or persistent side effects. Is low-dose oral minoxidil right for you? Low-dose oral minoxidil can be a viable treatment option for individuals experiencing hair loss, but it's not suitable for everyone. Factors such as age, overall health, and the underlying cause of hair loss play a role in determining candidacy. Ideal candidates for low-dose oral minoxidil are typically those with androgenetic alopecia, also known as male or female pattern baldness. This type of hair loss is characterized by a receding hairline and thinning hair on the crown of the head. Individuals with other types of hair loss, such as alopecia areata or hair loss due to medical conditions, may not experience the same benefits from low-dose oral minoxidil. It's essential to consult with a qualified healthcare professional to determine if this treatment aligns with your specific needs and medical history. Real people, real results, testimonials, and success stories. Countless individuals have experienced the transformative effects of low-dose oral minoxidil firsthand. Their stories provide compelling evidence of its potential to restore hair and boost confidence. Sarah, a 35-year-old woman who had been struggling with hair loss for years, shares her experience. "I had tried everything from topical minoxidil to expensive hair growth serums, but nothing seemed to work. Then my doctor recommended low-dose oral minoxidil, and within a few months, I started noticing a difference. My hair stopped falling out as much, and I even started seeing new growth. It's been a game changer for me." John, a 42-year-old man who had been self-conscious about his receding hairline, also found success with low-dose oral minoxidil. I was skeptical at first, but I'm so glad I gave it a try, he says. My hairline has filled in significantly and my hair feels thicker and healthier than ever before. It's given me a new lease on life. The future of hair loss. Treatment, expert opinions. Leading hair loss experts recognize the potential of low-dose oral minoxidil as a revolutionary treatment option. Dr. Randolph Tosti, a renowned dermatologist specializing in hair loss, remarks, "Low-dose oral minoxidil represents a significant advancement in the field of hair restoration. Its effectiveness, combined with its favorable safety profile, makes it an exciting option for individuals seeking a long-term solution for hair loss." Dr. Rodney Sinclair, a professor of dermatology, echoes this sentiment, stating, "I've seen remarkable results in my patients who have incorporated low-dose oral minoxidil into their hair loss treatment plans. It's a valuable tool that can help individuals achieve significant hair regrowth and improve their overall hair health." These expert opinions underscore the growing recognition of low-dose oral minoxidil as a safe and effective treatment option for hair loss. Its increasing popularity among both healthcare professionals and individuals experiencing hair loss suggests a promising future for this innovative approach. Beyond hair growth, additional benefits of minoxidil. Interestingly, minoxidil's benefits extend beyond hair growth. Studies have explored its potential in other areas, including wound healing and skin rejuvenation. Research suggests that minoxidil can accelerate wound healing by promoting cell growth and blood vessel formation. Its ability to stimulate collagen production may also contribute to its wound healing properties. Furthermore, minoxidil has shown promise in improving skin elasticity and reducing the appearance of wrinkles. Its ability to stimulate collagen synthesis may contribute to these anti-aging effects. Weighing the pros and cons, making an informed decision. Like any medical treatment, low-dose oral minoxidil comes with its own set of pros and cons. It's crucial to carefully weigh these factors before making an informed decision about whether it's the right treatment option for you. Low-dose oral minoxidil has demonstrated significant effectiveness in promoting hair regrowth, often surpassing topical minoxidil in terms of results. Unlike topical minoxidil, which requires daily application to the scalp, low-dose oral minoxidil is taken orally, usually once a day, making it a more convenient option for many individuals. While the cost of low-dose oral minoxidil can vary depending on factors such as dosage and insurance coverage, it may be a more cost-effective option in the long run compared to other hair loss treatments. As with any medication, low-dose oral minoxidil can cause side effects, although they are typically mild and temporary. Low-dose oral minoxidil is not appropriate for individuals with certain medical conditions or those taking certain medications. It's essential to consult with your doctor to determine your eligibility. Hair regrowth typically stops once treatment is discontinued. To maintain results, ongoing treatment with low-dose oral minoxidil is usually necessary. Seeking professional guidance, your journey to hair restoration. Embarking on a hair loss treatment journey can feel overwhelming, but it's crucial to seek professional guidance from a qualified healthcare provider. They can assess your specific situation, determine the underlying cause of your hair loss, and recommend the most appropriate treatment options tailored to your individual needs. During your consultation, be prepared to discuss your medical history, any medications you're currently taking, and your hair loss concerns. Your healthcare provider may perform a physical examination, order blood tests, or recommend a scalp biopsy to gather further information. Openly communicate your expectations, concerns, and any questions you may have about low-dose oral minoxidil or other treatment options. Your healthcare provider can provide you with evidence-based information, address your concerns, and guide you toward making informed decisions about your hair loss treatment. Embracing a holistic approach. Combining treatments for optimal results. In many cases, a holistic approach that combines multiple treatment modalities yields the most favorable outcomes. Low-dose oral minoxidil can be effectively combined with other hair loss treatments such as topical minoxidil, finasteride, platelet-rich plasma therapy, or hair transplantation to maximize hair regrowth and improve overall scalp health. Your healthcare provider can develop a personalized treatment plan that addresses your specific needs and goals, combining different approaches to optimize your chances of success. They can also advise you on lifestyle modifications, such as dietary changes, stress management techniques, and proper hair care practices that can complement your treatment and promote healthy hair growth. Remember, hair loss is a complex condition with various underlying causes and treatment options. By working closely with your healthcare provider, embracing a holistic approach and exploring all available options, you can navigate your hair loss journey with confidence and achieve your desired results.